Well, good morning, everyone. It is now 10:30, so I'm going to go ahead and start the presentation. So I just want to welcome everyone and thank you for joining today's Comagine Health Jiva Provider Portal training. My name is Kimberly Scott. I am the third-party administrator director for New Mexico Medicaid with Comagine Health. Also joining me today from my team is our intake manager, Melissa Amador, who will be helping me through the presentation. So I want to go over a few objectives for today's presentation. We are going to review the new Comagine Provider Portal upgraded environment. We're going to review some login information and view some of the enhancements to the Provider Portal, such as the dashboard features. We're going to do a demonstration on how to enter an episode, also search for an episode, and add the budget worksheet. At the end, we're going to go over where the resources will be, such as our quick start guides. We have quick start guides for UNMOR. We also will update those, and those will be on our website before our go live date. Just to note, the session is being recorded and will be available on our website before our go live date. Everyone in the webinar will remain on mute throughout the presentation, but if you have any questions, feel free to put them in chat. We will be monitoring throughout the presentation, and we'll have several opportunities to open up and remove you from mute. Just raise your hand and we can open that up for a discussion. So what's new? Well, that's why we're here today. So let's get started. Our provider portal upgrade is effective Monday, June 5th of 2023. The upgrade has a different look, but also it comes with a lot of enhancements, especially for the provider portal that we'll highlight today. Our customer service are prepared to support you, so they'll be ready to answer questions and also help you locate any of our resources on our website. Comagine Health website and provider portal access, there is a link to our login page from our website. We will go to our website at the end so I can show you exactly where the quick start guides, or I like to call them desk references, will be placed, where you'll be able to find them, along with the recording of today's presentation and the PowerPoint slides. I'd like to note here that any browser can be used in the upgraded version. I know that has been problematic in our current system, and we had recommended that certain browsers be used. That is not the case in this updated version. So once you log into our web page, you want to click on Programs, then select New Mexico Medicaid Services, which brings up our home page, provides a description of the services we provide and any announcements. But what I'd like to highlight is the Provider tab. This is where you'll find your checklist, as well as I mentioned, the desk references or quick start guides will be placed under the Comagine Health Provider Portal, along with the slides and the video. Also, I mentioned you can enter the login page directly from our website, and you'll see the arrow is pointing to go to Comagine Health Provider Portal. Once you click there, you can access the provider portal by clicking Provider Login, which will bring up the login page. You will use your currently assigned user ID and password, so you would enter that here. It brings up a disclosure page. Once you hit Agree, it launches you into our homepage in the provider portal. This is where we post announcements, such as if our customer service are off for a holiday and we're not available. We also put HSD user announcements here as well. Just to let you all know, I will be putting an announcement this week on the splash page in our current system of when those resources that I mentioned will be available. So you will see that coming. And just to let you know also, I will be posting an announcement for all of the users that our current system will go down June 2nd at 7 p.m. Mountain Time. And the new version or upgraded version will be accessible 6 a.m. on the 5th. One thing we want to highlight today is the dashboard features that I mentioned. So if you look on the right-hand corner, it says to do. This will bring up the dashboard for the user who's logged in, and under my dashboard, you'll see alerts. Alerts are no longer utilized in this system. Messages aren't used, neither are gaps in care. But my requests are the episodes that you've created in the last 30 days, which you would be able to click on, and we'll look at this during the demonstration, and you would see a list of everything that you've created. Also, it breaks down your requests by work in progress. You will see there pending submissions. These are ones that you have not submitted yet to Comagine Health. Maybe you're waiting on a document, a correction before you submit. You will also see further information requested. This is where Comagine Health has asked for additional information or a response to an RFI. And then you will see pending decision. So that pending entering the budget worksheet in this case. Down below, you'll see requests by type. Jiva breaks down episodes by inpatient or outpatient. Budgets are still classified as inpatient, so UNMOR staff will only see an inpatient bar here. And then off to the right-hand side, you will see decisions made in the last 7 days. Those will be budget worksheets that we have completed and entered into Omnicade. The next screen, if you click on team, is where you can manage the work for the entire group. So anyone that has a user ID, you will see here as a team member, and it will break down the group's work by work in progress or request by type, as I mentioned, which will be IT. But what's nice here is you'll see processed, pending submission, further information required, and pending decision. So this is a nice way to monitor the work since the alerts do go away. We're also, during the demonstration, are going to show you how to search and submit a new request under the menu feature. One thing I want to highlight in this new system, when you search, like in our current environment, you would put the client as New Mexico Human Services Department. The insurance ID number will be the Medicaid ID number with the 4 leading zeros. And you'll see down below are additional search options that we'll go through in the demo. So this would be if you're looking for decisioned, where we've entered the budget worksheet, you're just looking to see what's been completed. Episode type would be IP. Your request type will be UNMOR, and your treatment type will be UNMR annual or revision. And you'll see down below your search results will show the name of the member, the episode type as IP, your request type will say UNMOR, and then your treatment type will either say UNMOR or annual or revision. We also will show you how to create a new episode. And I'm sorry, did not update this slide. So for budgets only, once again, you would add client as New Mexico Human Services Department. Your insurance ID number is the Medicaid ID number with the 4 leading zeros. You would click on search, find your member, and add a new request. I'm going to pause here to see if there's any questions. Melissa, can you take people off mute? Any questions in chat?
Yes, we do have a question in chat. Will the link that users use to access the portal be the same link in the upgraded version?
That question has come up, and thank you for the question. We've heard that it will be exactly the same, but that's why I highlighted, if you go to our website, that will be updated, and that will be information once it's confirmed. I also will put that on the splash page. Thank you for that question. And like I said, the same user IDs and passwords should work. That's the understanding. But if there's any issues, please call our customer service staff on Monday if that's not the case. Any other questions?
Yes, could you go through the time again when Comagine will be unavailable?
Right, so the current system will go down. That is Friday the 2nd at 7 p.m. Mountain Time. And the upgraded version will be available June 5th, which is a Monday at 6 a.m. Mountain Time.
Great,
So
thank you.
we will be down, that weekend.
Okay.
Thank you for that. Before I get started in the demo, I want to, a change is hard. Like I said, there's a lot of new enhancements that we're really excited about for the providers to start utilizing. We think that this will streamline the submission process, but change can be difficult. So I want you to know we are here to help. Our customer service are available Monday through Friday, 8 to 5 at our customer service number, which I think that you're all familiar with, but it is here on the screen, 866-962-2180. And if there's any specific training needs from UNMR, I'm always available, and you can email me at kscott@comagine.org. I am going to move into a test environment, and we're going to get started with the demo unless there's any other questions or anything new in chat, Melissa, that you're seeing?
No, ma'am.
Okay, thank you. So I've launched into the training environment. So as I mentioned, you're going to land on the home page, and this is where you would see any announcements. Like in our current system here, this is a test environment, so it has some other contracts, but you can see where I've added specific information that applies to New Mexico. I'm going to move over to the dashboard. So you'll see here, alerts, messages, and gaps in care are not utilized, but you will see my requests, and it will pull up everything that I've created. So we've been doing some testing, so I have quite a few in there. In this system, to enter an episode, you would click on the gear here, and it allows you to open, or you can view the episode abstract, which will give you all of the information highlighted as it does in today's system. So you will see your demographics, provider roles, the level of care, dates, and it has some enhancements that I'll show you in the demonstration where you'll add your contact information. I'm going to go back to my dashboard. As I mentioned, it sorts it by work in progress. So I can see, oh, Comagine Health has issued an additional information. I can click there, pull up the episodes, enter the gear. Here you're able to sort as well. Budgets are inpatient, further information, and then you can customize your date range if you like to extend that. Down here, it does the same. You'll see a list, and you can sort with the same features. And then here you can check what budget worksheets we have completed. And then to get to your open the episode. And here, if you enter an episode and you need to respond to an RFI, add a note, you can find your, I don't have one here, but you would find your documents. If you wanted to look something up, add a document. Then we're going to go over to new request. As I mentioned, everything in the red asterisk is required. I'm going to search for my member. I found my member. I'm going to add the request as inpatient. Request type, UNMOR. And then treatment class does not have a red asterisk, but we would ask you to either put annual or initial. We're going to do annual. Priority is non-urgent, which is the only selection, and then UNMOR, annual. Diagnosis code is the default that you're using today, Z41.8. We'll add the diagnosis, and then we're going to go ahead and go to provider details. You will see UNMOR will pull up based on your group. You're going to hit attach. You're in the requesting role. Now you're going to attach your provider. So you're going to attach the case manager agency. We're going to use the provider ID lookup, which is the safest. That's what we recommend. You can search by the provider, but that can be problematic if you select the wrong one. I'm searching for peak. Then you want to choose multiple attach. You want to do this twice so you can add the emitting and treating. You can switch the role, click attached. And I'm going to have the requesting, emitting, and treating. I'm going to go down to the budget. The stay request is where you'll add the budget dates. So the start date, I'm going to select June 1st. And then you're going to enter 365. The system is will calculate if it's leap year. So you can always just use 365. And if it is a leap year, it'll make the appropriate adjustments or non-leap year. Click add. It'll refresh. This is new. I mentioned that there is an assessment built in the provider portal for contact information. Do not add assessment. You just want to click on this gear. It will come up as New Mexico Medicaid provider initial assessments. You click on the gear, you click start, and it's 2 red asterisks. So it's required for each submission. So you're going to go ahead and enter your contact information. It has a space for fax numbers, but we do most of our work in Jiva, so it's not necessary. We're going to hit complete. Scroll down. I'm going to add the budget worksheet. You can choose document type. It's a budget worksheet. I'll put my year in here. I'm going to browse for my document. I'm going to add my document and save. You've already put your contact information, but if you have a specific note for us, you can add it here. And hit submit. You'll see that the request was submitted successfully. At the top, you will see episode number as well as the reference ID number. I'm going to go ahead and copy this just to show you why it's important to keep one of these. I'm going to go back to search. As I meant, if you just put this, it's going to pull up every episode that's linked to this recipient using that Medicaid ID number. You can search by the episode type here. We can UNMOR. And it will pull up based on the filters that you've added here. But if I use the reference ID number, it's going to take you directly to that episode. And then you can open and go back to that. And then I should also see it here where you can enter. I've created 2. One as a practice, and you can enter on the gearbox. The memory list here, we do want to make note here that anywhere once you're logged into the provider portal, and let's say I've submitted a request, I did a search, it's going to keep all of these open. And it can be useful if you're looking into one episode, maybe looking for some information to enter into a new episode. So you can toggle back and forth between episodes here. But when you're finished, you want to X out of these or close all or log out. because in this system, only one user can be in an episode at a time. So if someone else from UNMR, your group, is trying to work in it for some reason, they're not going to be able to do so. Neither will Comagine Health staff. So once you've submitted that, you do want to X out so that we can then do our work on our side. And the calendar feature is not available in the provider portal. So we went over those. So I'm going to jump to our website. Well, let me pause there. Melissa, anything in chat, or can you open it up for discussion?
Yes, ma'am. Let me open up right now.
People might have questions after the demonstration. I can go back in there.
Hi,
Any
Kim.
new?
It's Larissa.
Yes.
I do have a question. So for the memory list, will it automatically be cleared out when folks log out of the system, or do they have to exit out before they log out?
No, once you log out, it will erase your memory list. So yeah, if you're in the practice of just logging out, you don't have to worry about it. But let's say you don't log out and you have something like here. If I walked away, I've submitted it to Comagine Health and I've walked away and did not log out, and I still have this here, we will not be able to work. And it will tell us it's locked to the user.
Can I ask one more follow-up question?
Yes, of course.
How long is it for the system to automatically log you out? Because I think it's like 10 minutes, like with inactivity. Is it the same in this upgrade?
Yes, and that question did come up. So I have posed that question to our business analyst just to confirm. But we've worked in it. Now, actually, I think it's a little longer. Maybe it's just me, but yeah, I'll put that on the splash page as well. I believe it's about 10, 15 minutes before it'll automatically log you out. Let's see, what do we have? Do we have anything in chat? Oh, that's Larissa. Oh, do you want me to move to an imminent request? Provider.
Sorry, I have a lot of questions.
Yeah, I was like, okay, okay, let me start from the top.
Okay.
Yeah, I can definitely, it's going to be the same, but I can show you the imminent request. For providers, will UNMOR be listed as a provider in addition to the case management agency? So when you select provider, it's going to be UNMOR, right? And then you'll add your admitting and treating as the case manager group. And then when we're done doing the entry into Omnicade, then we will add the requesting role for the case management group. Should the assessment have UNMOR contact information? Since they're the ones submitting, that's the intent of the system, is to put whoever submitted the contact information. And we should have the case manager information. But if you have it, it could be helpful to put there as well. Will the memory list be automatic? Oh, we talked about that, right? Douglas, just to clarify, a step-by-step UNMR data entry guide will be available. Yes. Yes, Douglas. So we are finalizing those, and those will be put on our website prior to June 5th. Okay, let me go back. I'm going to do a new request for imminent. It'll give you a soft stop if you've made a similar request in the last 24 hours. There it is. I have not tested this one, so let's an annual. I'm gonna phone a friend here. Melissa, have you tested this? Because this is brand new, so I don't know if it's probably user error, but it's not liking that combination. This might be something we need to take back. We'll make sure the imminent request is also addressed in the quick start guide, but all the steps would be the same. I'm just having difficulty. They did a refresh this weekend, so haven't tested everything as of this morning. But it's not liking. But yes, this is the request type that would be utilized, and then enter all the information as we did for the UNMOR annual budget worksheet. And I will show you where to find those. So if you go to www.comaginehealth, no, just comagine.org, it will launch our website under programs. There's a long list. So there is a filter for location. You can select New Mexico. We have several New Mexico contracts, but you want to choose New Mexico Medicaid. Click Learn More. As I mentioned, it'll bring you to our homepage. I have a list of our services and announcements, such as the Jiva training. But we want to go to providers. Checklists remain the same. The criteria has not changed. So all of our checklists are there. But if you go to Comagine Health Provider Portal, this is where you can go directly to the login page. Our administrator guide will be updated, as well as our user guide before go live. We will update frequently asked questions based on all of these sessions. We'll have feedback from all of the different sessions, and we'll address those. So the updated quick start guides will be here. So this one will be replaced with a step-by-step instruction to include imminent requests. Down below here, you will see the videos, and the PowerPoints will be listed. And then our contact page has our customer service number that I shared with you earlier, as well as my email address if there's any additional questions. I'm going to open it up again. Is there any additional questions I can answer? Oh, you guys were trying to give me tips. Okay, let me go back. Thank you for testing with me. Okay, let's try this again.
Unmute.
That might have been it. Oh, you guys are so good. There it is. Okay, so it is, I was trying to select UNMOR, but it is just budget review. Go down. Add your requesting. Do you have to do this assessment every time, or it won't let you submit? Even though we know how to reach you. Go ahead and enter that. It's pretty easy. And then you can put your note. Hit submit. Oh, I didn't finish. And then there it was, the imminent request was submitted. Thank you all for your help. I appreciate that. Any additional questions?
There's nothing in chat currently, Kim.
Thank you. Larissa, any other questions that you have? Carol, you and your team?
I don't have any. Thanks, Kim. I think though, if folks feel like this was a little too fast, I think that there is a little reassurance that those quick start guides will provide that step-by-step direction on how to submit. I personally have been in the provider portal testing, and I feel like it's really easy. So I feel like it's a lot less steps than what's currently in the current version of the Jiva system. But the quick start guides will provide a better or an easier way to kind of digest all of this information. I know, coming into a new system and getting a demo might be overwhelming, but I do feel like those quick start guides will really be beneficial. So if you guys need help, definitely reach out to Comagine Health intake staff. They should be able to help and provide additional clarification if you guys get stuck. And then if worst case scenario, if we need to go to UNMOR and do like an on-site training, we will be able to do that. But as you're aware, we're so spread thin everywhere across the state, and we want to try to focus on doing as much as we can virtually and utilizing those resources available first before doing an on-site training. So yeah, just feel that there's a little bit of reassurance in the quick start guides if you feel a little overwhelmed right now.
I have a question. Thank you for the presentation. But I was wondering how we locate issue cases that we'd have to process RFIs for. Because us and two other generalists on my team, and then Doug, process Jiva RFIs. So I was wondering where to find those.
So if you look on your dashboard, so any RFIs would be found under further information required that were issued by Comagine Health. So you could click here on your dashboard, or you would be able to sort by further information required. Does that answer your question?
Yeah, that actually.
Yeah. So there's several different ways, which is nice. So you can click right on the graphics. Oops, let me go back to my dashboard. Here is where they can be found, or here. So there's several different locations, or you can just go to my request and use your filters.
Okay, perfect. Thank you.
And all of this will be covered, like Larissa said, in the quick start guides. We are actually, we've done a lot of work on them, so they truly are a step-by-step. Although I even though I stumbled the system to do imminent request, but really the system will walk you through every step, and the system won't let you proceed and will normally give you a message, as you saw. It was saying, hey, something's wrong between your request type and your treatment type. So it won't let you go on, and just know that our team is available to assist. So it can be frustrating, but actually I've preferred working in this environment than the old system. So it's been a really good opportunity to be able to view and be able to test and see the advantages in this new system. Because we normally work on the other side of things. So going into the provider portal, I wish our side of things had the enhancements that the provider portal does, like the dashboard. So it's really easy to, I think, be able to manage the work. And I really enjoy the fact that you can view it by the team here as well. So for coverage issues, if you wanted to be able to say who needed, is there any actions that are needed, you could click on the member's name and it would come up, but we don't see any actions here. But you could go in and see that, oh, okay, it looks like Sadie has Shade has something that I need to check on. She's out today. Let me check on that for her. So it's actually really nice. Oh, well, there Yvette has one. So I could go in, clicked on her name and see she was waiting to submit something so I could finish it for her. Here. So those are some of the enhancements. So thank you all for joining today, and please let us know if there is any further assistance needed, and look for the quick start guides. Like I mentioned, in the current system, I will be posting that this week when those will be available to look over before our go live on June 5th. So thank you all. Have a great day.